Tatiana Rundick, Director of the Evelyn F. McKnight Brain Institute at the University of Miami, one of the only 4 institutes in the country funded by the gift from McKnight Brain Research Foundation. We are dedicated to uniting a diverse teams of scientists and clinicians to drive a cutting-edge research on age-related memory loss and cognitive impairment. We hope you'll find these talks informative and inspiring.
Hello, my name is Dr. Christian Agudelo. I am a sleep neurologist at the University of Miami, and I'd like to speak to you all today about how to sleep to age well. And so first I'd like to talk about why do we sleep? And so the primary reason we sleep that we know of for sure is we sleep so when we wake up, we're no longer sleepy. But truthfully, it's probably much more complicated than that. And some things that we think that we know is that sleep happens so we can consolidate our memories. The things don't get recorded into our long-term memory unless we sleep. And more than that, the things that we experience every day, all the interactions, all the little facts that we might observe, those generate novel connections between our prior experiences and our new experiences to give that context, to create knowledge out of facts. And also, a really important part about sleep is not just remembering, but it's forgetting. There's only so much space up there. And so to optimize our ability to remember and use that information, we got to forget things that don't really matter as much, that aren't as salient. And last, and also very important, is sleep is a moment of resting, of cleaning, of restoring the brain, of getting it ready for the next day and the next day and the next day. So I'd like to talk about what sleep is and use the parlance that a lot of us already know, and that's sleep stages. So there's really 2 types of sleep. One is non-REM sleep, or non-rapid eye movement sleep, and the other is rapid eye movement sleep. In the non-REM sleep category, there are 3 stages that you could consider as progressive depth. Light stage 1 sleep is the type of sleep that if you wake up from, you won't really realize you were asleep. Stage 2 is more moderate sleep. Important work, important physiological sleep processes are going on then. But beyond stage 2 is stage 3, and that is very deep sleep. The brain is in a slow and synchronous state, and that's when we think the brain is really cleaning itself of all the trash that accumulates through the day's activities. And that's one type of sleep. But then the REM sleep is a different type of sleep, and we cycle between REM and non-REM. And rapid eye movement sleep is a very fascinating type of sleep. If you look at it on brain waves, it seems like you're essentially awake. But if you look at the individual, they're completely paralyzed. Obviously, they look like they're sleeping. And in REM sleep, that's when we dream. And we're not entirely sure what dreaming does, but we think, like I mentioned before, it's when we relive our experiences of the day, we connect it with prior experiences to create knowledge and give it context, but also we try to, REM sleep can reduce the sort of emotional experiences from those moments we had in the day. So if things are traumatic, REM sleep might help us remember and encode those experiences without the trauma that occurred when we actually experienced them. So that's non-REM and REM and roughly what's going on in each of them. So what are benefits of sleep? And I talk to my patients a lot about this. There's the short-term and the long-term benefits of sleep. In the short term, when you sleep better, you have better concentration. You're capable of paying attention to things, which is really important. Because if you're not paying attention to things, you can't remember, you can't use the information, and so things become complex. Any cognitive function begins with your ability to pay attention. The next is behavioral control. We all have an ideal of who we want to be, and we need behavioral control to make the decisions we want to make, to not do the things we don't want to do and to do the things that we do want to do. Sleep's vital for that. Another important part of sleep is mood. How capable are we of engaging difficult emotional situations and not letting them overcome us or take over us? Sleep's very important for that. Hunger and appetite control are also regulated by sleep. So any effort at optimizing our health and maybe optimizing what we eat is going to rely on our ability to sleep well. And last is energy and wakefulness. Anything we want to do while we're awake requires our ability to feel awake and have the energy and motivation to do those things. And those are the short-term benefits of sleep. But there are also long-term benefits of sleep. We have observed that those people whose sleep changes the least over the course of their life have healthier lives. And so, for example, we think sleep slows cognitive aging. We also know sleep is vital to treating mood disorders like depression or anxiety, and also maybe reducing their occurrence. And last, sleep is very important for protecting our hearts and the vascular systems of our brains. I'm talking preventing strokes and heart attacks. And these are benefits long-term that we think sleep impart on all of us. So how do we optimize sleep? And the term you might hear everywhere is sleep hygiene. And I kind of love that it's everywhere. There is really good advice all over the place, which is generally not the case for other topics about health, but I'm very happy with the way sleep health has been disseminated. And I'd like to consider sleep every night an opportunity to be healthy. Let's not dwell on the past and be upset about how we might have slept last night, last week, or the last 10 years. Tonight and every night thereafter is a new opportunity to be healthy. So, number one on my advice for everyone in terms of sleeping, and that's regularity. And what does that mean specifically? It's sleeping at the same time every day. And to even be more specific, waking up at the same time every day. This helps entrain our circadian rhythm. It helps our body know when we're supposed to be awake, when we're supposed to be in sleep, and also it helps our body know when everything else is supposed to happen, when we're supposed to be hungry, when we're supposed to be alert, and so forth. The second piece of advice is invest. And I say invest time in sleep. If you want to function optimally, we need 7 to 9 hours of sleep. And I'll put that into context. That's 7 to 9 hours of the sleep that we feel we're getting, not what our actigraph or our watch or our ring or our bed is telling us we're sleeping. It's sort of our self-report of sleep. The next is serenity at bedtime. And I like talking about this because we all hopefully had this once. Each of us, when we were little kids, hopefully had a grandparent, a parent, a loved one that tucked us in, told us a bedtime story. They prayed to us, they sang us a song, and they made sure we felt amazing when we went to sleep. And we got older, and that was no longer done for us, and we never do it for ourselves either. And I think there's something important about creating serenity at bedtime. And that means for us some basic things that everyone should do. And that's minimize stimulation, light, emotional stimulation. You like to watch the news at night? That's great, but you can watch it in the morning. No need to go to bed feeling angry. You can wake up and feel angry, right? And get your day going that way. You want to avoid social media. Things that are activating are the last thing you want to do before bedtime. You want to ease yourself. Create your own routine that you know works for you. Activity in the day. The more we do, the more likely we are to fall asleep. And so the sorts of activity that build up our sleep pressure, our drive to fall asleep at the end of the day, are all the things you might think do this, right? Physical activity, thoughtful activity, intellectual, using your mind, projects, things that are purpose-driven, but also social interactions. You know, as long as you're doing something, you are building your sleep pressure. And to put an example of the antithesis or the opposite of building your sleep pressure is sitting somewhere and having things done for you that don't require thinking. Not that watching TV is bad for you, not that scrolling social media is bad for you, but it's not the sort of thing that builds your sleep drive. And last, the sun. The sun's really important to our physiology. And one way we can use the sun to optimize our sleep health is make sure your body knows that the sun is out when you wake up, as soon as you wake up. So that means exposing your body, specifically your eyes, to external sunlight. It can be through a window, preferably outside. And please, don't look at the sun. No one wants you to do that. But your body does want to know that the sun is up every morning, and so give it that opportunity. So that's advice for everybody. But there are some people that have disorders of sleep. And so I want to talk about some of the most important ones. So the first is insomnia. There is a technical definition for insomnia, but quite basically, are you someone that considers yourself to have difficulty falling asleep, staying asleep throughout the night, or waking up earlier than you think you should? Roughly, that's what insomnia is. And it really matters because it can diminish your daytime wakefulness, your ability to do things when you're awake. Not everyone has insomnia. Many people have these symptoms and it's some other aspect of their sleep or their mental health causing this. So it's important before considering yourself or diagnosing oneself with insomnia to see someone, a sleep physician or any health provider that's capable of helping you come to that diagnosis. So if you have insomnia, what are treatments for insomnia? First, it's all the habits that I just mentioned before about how to sleep well. But in addition, there's other things we can do. One is napping. So napping is an interesting topic, debated and not as fully understood as you might imagine. If you're someone that naps and you have trouble falling asleep at night, I think there's two things you can do with your nap. First is move it as far away from bedtime as possible. And if you think about it, it makes sense. If you sleep before bedtime, you're going to ruin that sleep drive you have at that time. If you eat right before your meal, you're not going to be hungry. So you want to nap as far away as possible, just enough to maintain your wakefulness throughout the day, and hopefully that doesn't interfere with your sleep at night. But if it does, and that frustrates you, then maybe the nap is not the best thing for you to do. Another thing that's really important is go to bed only when sleepy. And that might seem like a silly piece of advice, but there's lots of reasons for this. One is our brain makes associations with what we do and where we do them. When you go to the kitchen, you have an idea of what you're going to do. If you get on a car or a bicycle, your brain prepares for that activity. And when you get in your bed, your brain prepares for the activity it expects to do while on the bed. But if you're somebody that gets in bed and waits a long time to fall asleep and they feel frustrated by that, well, then when you go to bed, your brain's going to prepare you to be frustrated, not to go to sleep. If you go to bed and you're going to watch TV for an hour or two, well, then when you go to bed, that's the state of mind your brain's going to be in. So we like to preserve the bed for sleep and only go to bed once you feel sleepy. What happens if you wake up in the middle of the night and you have trouble falling back asleep? I tell folks, the moment you feel frustrated, that's your cue to get out of bed and do anything else. It can watch a sitcom that you've seen 1,000 times. It can be read a book. It can be wash the dishes. Something low-key, dim lighting. And once you feel sleepiness come back, be honest with yourself, and then you can go to sleep. Avoid struggling to fall asleep in bed. That's a continuation of exactly what I said before. The struggle, the frustration, it can happen, and it will happen, but try to isolate that to anywhere except your bed. Meditation and mindfulness, that goes back to what I mentioned before. It's important to create a space, a ritual with which we enter sleep. If you have trouble falling asleep, meditation and mindfulness are excellent approaches to try to reduce those ruminations that keep us awake and keep us away from sleep. Reduce alcohol intake. This is an obvious one, but not for everybody. You know, to go to sleep, there's two things that have to happen. One is you have to turn on the machine in your brain that controls sleep. And you also have to turn off the machine in your brain that controls wake. So what alcohol does is it helps people that struggle to turn off the wake machine, and that's what that does. Alcohol allows you to sort of quiet the waking brain. But what it's miserable for is the sleeping brain. That sleeping machine is highly and detrimentally affected by alcohol. It makes your sleep fragmented. It increases your heart rate throughout your sleep. It reduces the restfulness of your sleep. So I understand why it's used for sleep, but truly it's used to reduce wake. It's not to help sleep. And you want to move any alcohol intake as far away from bedtime as possible. And last is, if you're having difficulty and you really can't take care of it yourself, there's no reason to wait forever. If you have symptoms of insomnia, that's a great time to see a sleep physician. Another very common disorder is obstructive sleep apnea. And so I'll describe what it is right now. It's every time you go to sleep, there's these recurrent events of airway obstruction in sleep. Essentially, the airway in the back of your throat collapses like a wet paper straw. And every time that happens, there's a number of consequences. And the obvious ones being you can't breathe because your airways collapsed. So your oxygen levels might decrease temporarily. And eventually your airway opens up, either on its own or often it requires a brief awakening from sleep, awakenings you don't even remember. And so what symptoms? If you have sleep apnea, what symptoms do you have? First, many people are completely asymptomatic or blissfully unaware of their symptoms. Alternatively, obstructive sleep apnea happens gradually. It doesn't happen all of a sudden. So as the years pass, you might get used to these symptoms. You might say, oh, I'm just getting older, and this is normal aging, but that's not necessarily the case. It could be in part sleep apnea. So things that happen at night that might indicate you have sleep apnea. Number one and most common is snoring. The same process that leads to snoring is the narrowing of the airway, which is basically just a short way from a full collapse of the airway. So snoring. Dry mouth, because you're breathing through your mouth. Your brain is trying to figure out how to breathe, so it's going to open its mouth and breathe through the mouth. You're going to lose all your moisture that way. You might wake up gasping for air and wonder, what on earth is happening? You might sweat more, because every time your airway collapses, you're kind of choking from the inside. So your body responds with like a subtle panic response. Your heart rate shoots up, your blood pressure shoots up, you might sweat a little bit. And last, bathroom. A lot of people go to the bathroom a lot more at night than they do during the day. For men, they might say, oh, it's their prostate. But women don't have that explanation. And the truth is, when I see patients, a lot of them is, I get up to pee 3, 4, 5 times a night. And people don't recognize or associate that with sleep apnea. But that is a very, very important symptom associated with that. And during the day, if you have sleep apnea, you might be sleepy throughout the day, struggling to stay awake while in a meeting, watching TV, or driving your car. Alternatively, you might also have poor concentration. I keep forgetting things. I can't concentrate. I enter a room, I don't know where I am or why I got in there. And sure, that happens with aging, but also it happens with poor sleep. And you always want to optimize your sleep just to prevent these issues from happening in the first place. And like I said earlier, it can begin in young adulthood when you're essentially indestructible and you don't notice these symptoms and they build up gradually. So there are long-term consequences to obstructive sleep apnea for the mind and the body. So it's very important, if you have any of these symptoms, bring it up to your primary care doctor, make an appointment with a sleep doctor, and get it checked out. And so what treatments exist for sleep apnea? Because so many of you out there, if not already, will have this one day. First, it's a discussion with a sleep physician. The best treatment for sleep apnea is the one you will actually do. And everyone's different. Everyone's situation is different. The most common treatment for sleep apnea is positive airway pressure. You might know it as CPAP. You might know it as the mask your uncle wears to go to sleep. But ultimately, it keeps your airway from collapsing by just breathing higher pressure air. And it might seem like a bizarre thing for people at first, but truthfully, I have so many patients that feel overwhelmingly thrilled when they get diagnosed and get used to their CPAPs because their lives can fundamentally change for the better. Positional therapy. If you have mild sleep apnea, just sleeping elevated could go a long way, or sleeping on your side. And then other interventions that exist is a mandibular advancement device, which kind of keeps your jaw forward, and a hypoglossal nerve stimulator, also known as Inspire surgery, which are all things you can discuss with a sleep physician. And other sleep disorders, because it's not just sleep apnea, it's not just insomnia. You might notice your bed partner or yourself, you act out your dreams. And this is an important one to figure out. Dream enactment can be a sign of neurodegenerative disease. It can be a sign of post-traumatic stress disorder. And it's something that should definitely be evaluated because you want to keep yourself safe. Nightmares. To those that don't have nightmares, you can't fully conceive of how aversive a nightmare disorder can be to someone. And there are ways to mitigate the severity of nightmares, and that's an important reason to see a sleep physician. Advanced and delayed sleep phase. Basically, do you sleep later and earlier than anyone else? That's something that can be adjusted if we choose to, something else a sleep physician can do. Limb movements. Do you move too much right before bed? Do you feel restless? Do you feel uncomfortable? Or are you told that you move your legs constantly throughout the night? That's important because that can take away from the quality of your sleep. And last time, disorders of daytime sleepiness. If you're overwhelmingly sleepy, There are disorders where that is just the primary symptom, like narcolepsy and idiopathic hypersomnia. So these are all things that you can discuss with your sleep doctor. That's why we're here. And with that, I'd like to thank you all, and I hope you all sleep well, and I appreciate your attention.
Thank you for watching. Thank you to all the participants who have come to our lectures. Thank you to our partners. And most of all, thank you to our sponsors. See you next time. Keep aging like a pro.